Now, a few weeks ago, the Presidential Steering Committee on COVID-19 stated that it had no intention to demand clearances from fresh arrivals from China, which had just relaxed its 2-year-old rigid COVID protocols. But the story seems to have taken a different coloration, with the government now demanding evidence of COVID-19 vaccination from arrivals in Nigeria. Renowned virologist Professor Oyewale Tomori joins us now to have a chat around this and other public health issues such as diphtheria and Lassa fever. Professor, it's good to have you on Newsday. Thank you for joining us.
It's always my pleasure. Thank you.
It's a pleasure to have you as well. Now, I'd just like to start with the basics. We do know that, some people still feel reservations regarding COVID-19 vaccinations. Just wondering if this new development makes any provision for PCR testing as well, for that to be presented in place of vaccinations, of proof of vaccinations.
There are two approaches. The test is to protect the country, to ensure that nobody comes in with the disease. The vaccination is to protect you yourself in case the thing is in the country. So first and foremost is the individual. So that's why go ahead and get the vaccination. So long as the virus is in any part of the world, it can enter here any moment. And therefore, let us go and get ourselves protected. On the other side, the government requiring tests for coming in is again to protect the country in a way that nobody who has the disease comes into the country to become the source where the disease can be spread. So we need both of them. We need people to be vaccinated. We need the government to test people coming in.
Right, thank you for that. Now, these are all welcome developments, especially the introduction of the vaccination certificate. But is this enough? Before, at the peak of the pandemic, there was sensitization around wearing masks, around sanitizing hands and so forth, which understandably is no longer as loud as it was. So this introduction of the vaccination certificate for travelers, is that on its own enough to protect Nigeria from another surge of COVID-19 cases?
No way. Vaccination alone is not enough. And if you remember, during the time the COVID thing, there were a combination of so many things, non-pharmaceutical interventions, wash your hand, keep the distance, wear your mask, and then get vaccinated. So all the four were actually working together to prevent the spread of the disease. So if you're focusing on only one now, you're only doing 1/4 of what you need to do. So people, because the virus is still around in another part of the world, I keep stressing that we're not free from it. Remember about a week after the upsurge in China, about two plane loads of people who came into Italy, 50% of them were positive. So really, we need to be more up doing than what we're doing. I mean, I think there's this lackadaisical attitude that we have. Vaccination alone is not enough. You must check the people who are coming in, make sure they're not bringing in. And in actual fact, when you talk about vaccination, we assume that everybody who is vaccinated is protected. There's no vaccine that is 100%. And that's why we keep repeating vaccination. Take the issue of yellow fever, take the issue of polio. I mean, I regard differently from the way you will react. And that's why you never find any vaccine they tell you is 100% efficacious. So it has to be because of individuality. So the fact that I have the certificate, I want to be doubly sure that I don't have the virus. Therefore, both must go together.
Well, thank you, Professor. Well, as of January 15, we know that there were 42 recorded cases of COVID-19 in Nigeria, and the WHO has also confirmed that as at December 2022, there has been an upsurge of COVID-19 infections. Bearing in mind that the elections are just probably a month away, and it's already with us, the COVID-19 cases have resurfaced within the country. Are you concerned, based on what you mentioned about the lackadaisical attitude when it comes to protection, that enough might not be done ahead and during the elections, which could actually lead to even a greater spike in more COVID-19 cases?
The election provides a great opportunity for spreading the virus. because large number of people are meeting together in a very small area. So the first thing for me, I would not attend any election rally. Even if I wear my mask and all those kind of things, because millions or hundreds of people are surrounding you who you don't know may be having the disease, and therefore you want to protect yourself. Self first. So I tell you, I will not go to any election rally. Even if I have to go to, like even here where I am at a big meeting, I will wear my mask in public, where there's going to be people coming together, especially in a closed room where you're using air conditioning. I will wear my mask in such places. When I travel in the plane now within the country, I wear my mask. Again, maybe for me, at my age and the part of other comorbidities, I need to doubly protect myself. But that is also goes for other people. Get yourself protected. You are the most important person involved in this disease. So protect yourself. So, like I said, election rallies are a good opportunity for the virus to spread because large number of people are congregating together. And therefore, these are something we need to, again, stress the important. Wear your mask where you go to all those rallies, if you must. And let me say one thing. A lot of people think that Malawi and Mozambique had not had wild polio for the last 17 years. Suddenly, in July or something last year, they had cases of wild polio, which came from Pakistan, which is the country that still has polio. So if something like that is going, we must be prepared. I mean, China has it. We don't even know what from here, go to China and come back. So we must get ourselves ready. And I think the government should be more dynamic and more proactive in taking action over this issue.
Right. Now, I'd just like to take a quote from the communique surrounding the... Professor Tomori, I can hear you loud and clear. I just want to take a quote from the communique around this new policy around requiring vaccination certificates. And it says, all international travelers arriving in Nigeria are now to provide evidence of vaccination at the point of entry. And it was agreed that the unvaccinated passengers arriving from other countries may have to be vaccinated at the airport. Now, there's still so many reports flying around about the potential side effects of some of these vaccines, including strokes and blood clots and so forth. Is it fair to force travelers who maybe need a little bit more time to do their research and to gain confidence in this vaccine to be vaccinated at the point of entry?
First of all, there's no vaccine that takes effect the day you give me the injection. And one dose does not give me the full protection. So I'm just looking at the rationale behind vaccinating people at the point of entry. The fact that you vaccinated me today does not mean I'm developing immunity that day you gave it to me. It's still going to take some time. I would be more focused on that individual bringing the virus into my country. And the first thing I would do is to test the person to be sure that it doesn't have. Vaccination can come later. Vaccination at the point of entry, I don't think it's, to me, I mean, the scientific base of it, I don't understand it. Like I mentioned, if you get vaccinated, it takes you maybe a week or 10 days before you even develop immunity. So what's the advantage of that? If that guy is carrying a virus and comes to the country, and before he develops immunity a week later, he will have spread it, you've seen, all over the whole place. So I think we should use science in determining what we're talking about. Vaccinating at the point of entry, especially for COVID, that requires 1, 2, or 3 vaccinations, doesn't make sense to me at all. What we need to do, those who are not vaccinated, even if those who are vaccinated, because we're not even sure whatever it is, I would test them at the point of entry. If you are positive, I put you in isolation. If you are not, I'll tell you to monitor yourself or find a way of monitoring yourself for the next 7 days before we take the next action. I think we're going the wrong direction. You probably noticed in the system, I mean, that same report, the government was saying that they're going to take a decision, but they were going to test. I mean, it's like 2 weeks ago when I first said about that one. Up to now, they still have taken a decision whether we should be testing. Other countries, the days they take immediate action. Something we should do as a marathon, I mean, as a 100 meters dash, we're doing like a marathon. But then the disease will have spread over the whole country. I think it doesn't make sense to me, and I should say, it doesn't make sense to me vaccinating people at the point of entry, because that vaccine is not of immediate effect to that person. The one that worries me is somebody coming in with the virus, and the easiest way to do that, test the person at the point of entry. And then you know whether this guy has, of course you will miss some, but at least you get the ones that are positive.
Thank you, Professor. Now, of course, there are two other diseases that are causing or wreaking havoc in Nigeria. That's including Lassa fever and diphtheria. There's been an upsurge with diphtheria in the northern part of the country, and Lassa fever is also having a huge spike. Do you think enough is being done to prevent the spread of these diseases? I know we've already handled COVID, but what about these two?
No. Let's be frank with each other. No, if we are doing the right thing, we won't be having the epidemic. I mean, that's the simple thing. That's the good thing about epidemiology. If you're doing your surveillance, if you're vaccinating your children, you don't see cases occurring. Diphtheria up in the north, you're seeing the large cases. It's not because I think the cases are not occurring. I think they're now coming together. We're seeing so many cases around the same time. Therefore, we notice that it's there. I believe diphtheria is cases occurring in different parts of this country at different times, maybe 1, 2, 3 here, but they have not come to our attention. Now we're seeing so many cases occurring around the same time. Then we're shouting that, oh, there's diphtheria outbreak. The problem is, we are paying for our delinquency is not having a high level of vaccination. Go and check the records of vaccination. The vaccination for where the diphtheria, DPT, is concerned, it is usually less than 60%. So we have 100 children this year. We vaccinated only 60 of them. So we have 40 of them vulnerable. Next year, we had another group, if our vision remains the same, we have another 40 extra. I'm just trying to simplify it as much as possible. In 3 years, we'll have 120 children who are vulnerable. Of course, then you see the epidemic will just come, and then we notice them, because many more people are vulnerable and are getting infected. That's with the diphtheria. So when you go back, if you raise your immunization coverage for your children to the 80s and the 90s, we'll be seeing only occasional cases of diphtheria, not epidemic. You're talking about the north. I expect it's a matter of time, depending on the coverage of DPT in the other parts of the country. We expect more to come. I mean, so it's not a surprising thing if it comes. As for Lassa, this disease has been with us since 1969. 69. How many years with that? Almost 50-something years. And every year we keep talking about Lassa as if it's something new. So something is wrong with us somewhere. And if you go and check NCDC's data, you find that since 2019, the number of reported suspected cases have almost been doubling. The only time we had the lower figure was in 2021, when we focused our attention on COVID and forgot about Lassa fever. But now this number has gone up to 8,000 from what it is. So the numbers are increasing. So what has happened? Why are we not? It's something we know every year that is coming. How come we're always shouting during the dry season, oh, Lassa fever, Lassa fever? What have we done about it? We're waiting for international aid to help us. We're waiting for WHO.
Necessary questions that need to be answered. Professor Oyewale Tomori, thank you so much for your time.